Welcome to Ways to Avoid Erectile Dysfunction, Part 1. Today, we'll discuss a common concern for men, especially those over 40, erectile dysfunction or ED. ED is the consistent inability to achieve or maintain an erection firm enough for satisfactory sexual intercourse. It's the most common sexual problem in men. This condition can significantly impact self esteem, relationships, and overall quality of life. Understanding its causes is the first step towards prevention. Several factors contribute to ED, broadly categorized into physical, psychological, and lifestyle related causes. Let's explore these in more detail. Physical factors often involve cardiovascular health. Conditions like atherosclerosis, high blood pressure, and coronary artery disease can reduce blood flow to the penis. Diabetes is another major physical contributor, as high blood sugar levels can damage blood vessels and nerves, including those vital for erectile function. High cholesterol and obesity also play a role, contributing to cardiovascular issues and increasing the overall risk of ED. Hormonal imbalances, such as low testosterone, can affect both libido and erectile function, while neurological disorders can interfere with nerve signals. Other physical conditions like kidney disease and Peyronie's disease can also contribute to ED, highlighting the body's interconnected systems. Beyond the physical, psychological factors are significant. Stress and anxiety can directly interfere with sexual arousal and performance. Depression can reduce sexual desire and impair erectile function, while relationship problems can create emotional distance that impacts intimacy. Performance anxiety, the fear of sexual failure, can create a self-perpetuating cycle of anxiety and ED, further complicated by low self-esteem. Lifestyle choices also play a crucial role. Smoking, for instance, damages blood vessels, reducing vital blood flow to the penis. Excessive alcohol consumption can lead to nerve damage and hormonal imbalances, while illicit drug use can impair sexual function. A sedentary lifestyle increases the risk of obesity and cardiovascular disease, both major contributors to ED. Poor diet, high in unhealthy fats and sugars, also contributes to cardiovascular disease and, consequently, ED. Now, let's shift our focus to proactive strategies for prevention, starting with foundational lifestyle modifications. A healthy diet is paramount. A balanced intake of fruits, vegetables, whole grains, and lean protein can significantly improve cardiovascular health. The Mediterranean diet, rich in flavonoids, L-citrulline, folate, and L-arginine, has been particularly linked to improved sexual function. Foods to include are berries, apples, watermelon, spinach, nuts, legumes, fish, and olive oil. These are packed with beneficial nutrients. Conversely, limit red meat, processed meats, fried foods, full-fat dairy, refined grains, and sugary drinks to protect your cardiovascular system. Regular exercise, especially aerobic activity, is crucial. It improves blood flow, reduces stress, and can even boost testosterone levels. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This could include brisk walking, running, swimming, or cycling. Maintaining a healthy weight is another key strategy. Losing excess weight can significantly improve cardiovascular health, hormone levels, and erectile function. Quitting smoking is one of the most impactful changes you can make, as it directly improves blood vessel health and overall circulation. Moderate alcohol consumption is also advised. Limiting intake can prevent nerve damage and hormonal imbalances that contribute to ED. Adequate, high-quality sleep is essential for overall health and plays a role in preventing ED. Prioritize restful nights. Finally, stress management techniques like mindfulness, meditation, yoga, and deep breathing can significantly reduce stress and anxiety. By adopting these foundational lifestyle changes, men over 40 can proactively address ED, improve their sexual health, and enhance their overall well-being. Join us in Part 2, where we will delve into medical management, pelvic floor exercises, and psychological support strategies.